Hello! Here's a simple guide to the correct sequence for putting on your personal protective equipment, or PPE, as recommended by the Centers for Disease Control. Number 1. Hand hygiene. Make sure to properly wash your hand or use an alcohol-based hand sanitizer before putting on your PPE. Number 2. Gown. Fully cover the torso. Make sure that the gown is covered from neck to knees, arms to end of wrists, and wrapped around the back. And make sure to fasten the straps on the back of the neck and waist. Number 3. Mask or respirator. Secure the ties or elastic bands at the middle of the head and neck. Number 4. Goggles or face shield. Place the goggles or face shield over your face and eyes and adjust it to fit. And finally, number 5. Gloves. Make sure to extend, so it should cover the wrist of the isolation gown. Remember, PPE must be donned correctly before entering the patient area. PPE must remain in place and be worn correctly for the duration of work in potentially contaminated areas. PPE should not be adjusted during patient care. Now for taking off your personal protective equipment. There are a variety of ways to safely remove PPE without contaminating your clothing, skin, or mucous membranes with potentially infectious materials. Remember to remove all PPE before exiting the patient room except a respirator, if worn. Remove the respirator after leaving the patient room and closing the door. The correct sequence for taking off your PPE are as follows. Number 1. Gloves. First, remove your gloves observing the proper steps to avoid further contamination. Number 2. Goggles or face shield. Remove your goggles or face shield from the back by lifting headband or earpieces. Number 3. Gown. Unfasten gown ties, taking care that sleeves don't contact your body when reaching for ties. Number 4. Respiratory protection or face mask. Never touch the front of mask or respirator. And finally, number 5. Wash hands or use an alcohol-based hand sanitizer immediately after removing all PPE. Remember, PPE must be removed slowly and deliberately in a sequence that prevents self-contamination. A step-by-step process should be developed and used during training and patient care. Perform hand hygiene between steps if hands become contaminated and immediately after removing all PPE. Here's a step-by-step guide on removing your gloves. Using a gloved hand, grasp the outside of the other gloved hand and peel off the first glove. Hold removed glove in gloved hand. Slide fingers of ungloved hand under remaining glove at wrist and peel off second glove over first glove. Discard gloves in a waste container. Perform hand hygiene. Some things to remember when removing your gloves. Don't remove by grasping the fingers of glove. Don't touch outside of the glove with bare hands. Never use your mouth or teeth to pull off the glove. How to wear and remove your face mask. Secure the ties or elastic bands at the middle of the head and neck or behind your ears. Fit the flexible band to your nose bridge. Fit the mask to snug your face and below the chin. When removing your mask, grasp the bottom ties or elastics of the mask, then remove without touching the front. Discard in a waste container. Perform hand hygiene. Remember, use safe work practices to protect yourself and limit the spread of contamination. Keep hands away from face. Limit surfaces touched. Change gloves when torn or heavily contaminated. Always perform hand hygiene. This is a friendly reminder from your friends at HHRG. Keep safe and let's win lives!